upcoming pharmacy tech uh, tests. Okay, let's get started with side effects quiz. Which of these drugs is most likely to cause inflammation and rupture of muscle tendons? Okay, I don't know the answer, but I'm gonna pick whatever and then later on I'll find the answer if it's correct. What I think is uh, ciprofloxacin. That's what I think. All of these side effects are associated with opioid analgesics, except which? Um, dry mouth, metallic taste, lactic acidosis, and vitamin B12 deficiency are side effects most associated with which of these drugs? Um, methotrexate, I think. Oh man, already wrong. Okay, it already told me. It timed out on me. Okay, I'll tell the answer then. It's I'm correct. The first one. It's ciprofloxacin is an antibacterial drug that belongs to the fluoroquinolone class. Are associated with increased risk of muscle tendon inflammation and rupture. Co-prescription with prednisolone increases the risk of tendon rupture. Other fluoroquinolones include moxifloxacin and levofloxacin. All of these side effects are associated with opioid analgesics except which? Pupillary dilation. Opioids analgesics are known to cause meiosis, pupillary constriction, not dilation, mydriasis. Other side effects of opioids include respiratory depression, dry cough, constipation, itch, and drowsiness. Opioids include drugs such as tramadol, morphine, codeine, and dihydrocodeine. Metallic taste, lactic acidosis, and vitamin B12 deficiency are side effects most associated with which of these drugs? It's metformin. Metformin is drug used in the treatment of type 2 diabetes and polycystic ovary syndrome, PCOS. Side effects include a metallic taste, lactic acidosis, and through long-term use, vitamin B12 deficiency. Other side effects of metformin include weight loss and gastrointestinal disturbances. Which antibacterial drug class is associated with side effects which include tooth discoloration, enamel hypoplasia, and photosensitivity? It's tetracyclines. Side effects of tetracyclines include tooth discoloration, enamel hypoplasia, and photosensitivity. Other adverse effects of tetracyclines include nausea, vomiting, hypersensitivity, reactions, and esophageal irritation. Examples of tetracyclines include doxycycline, tetracycline, and minocycline. Fatigue, cold, extremities, headaches, nightmares, and impotence in men are most likely to occur with which of these drug classes? Beta blockers. Side effects of beta blockers include cold extremities, fatigue, impotence in men, and nightmares. Only some beta blockers cause nightmares, such as pro- propranolol. Dizziness and lightheadedness are also common side effects. Beta blockers include drugs such as bisoprolol, labetalol, and metoprolol. Muscle pain and myopathies are side effects most associated with which of these drug classes? Statins are drugs used to lower LDL cholesterol levels, whilst increasing good cholesterol, HDL cholesterol. Side effects include muscle pain, myopathies, and, in rare cases, rhabdomyolysis, where muscle itself breaks down. Other side effects of statins include headache, elevated liver enzymes, and an increased risk of developing diabetes type 2. Statins include drugs such as atorvastatin, simvastatin, and lovastatin. Which of the following side effects is most associated with ACE inhibitors? Persistent dry cough. ACE inhibitors such as lisinopril and ramipril can increase bradykinin levels in the lung. This can cause many patients to develop a persistent dry cough. Other side effects of ACE inhibitors include hypotension and hyperkalemia, elevated potassium levels. Patients who are finding the cough difficult to tolerate are often switched to an angiotensin receptor blocker drug, such as candesartan or losartan. Which of the following drugs can cause esophagitis, hypophosphatemia, and osteonecrosis of the jaw? Alendronic acid is a bisphosphonate drug, a drug class used in the management of bone disorders such as osteoporosis and Paget's disease of bone. Side effects include esophagitis, low phosphate levels, and osteonecrosis of the jaw, ONJ. Other bisphosphonates include zoledronate and palmidronate. All these diuretics can cause hypokalemia, except which? Amiloride. Amiloride is potassium-sparing diuretic, meaning that the potassium is not readily eliminated from the body. This ensures that potassium levels do not decline, unlike what we see with other diuretics, such as loop and thiazide diuretics, which all cause hypokalemia, low potassium levels. Other potassium-sparing diuretics include triamterene and spironolactone. Which of these drugs can cause blood to turn green? Sumatriptan is a drug used to treat migraine and cluster headaches. Triptans, as a class, are used for this indication. In overdose, sumatriptan can cause the rare condition, sophomoglobinemia, a condition in which blood can turn green. This is because sumatriptan has sulfur within its structure, and when this sulfur molecule is incorporated into the hemoglobin of blood, it turns the color green. When sumatriptan therapy is stopped, this discoloration resolves within a couple of weeks. Okay, now we're going to the side effects too. Side effects. Hypoglycemia can occur in patients taking which drug class? Oh, this one I don't know the answer. Maybe. Let's pick the answer and then it will tell me the answer. Okay. Hypoglycemia can occur in patients. What is it? Look, I'm gonna tell you now. If we don't open them chips, there is no man. What? You want me to open that chips? Hypoglycemia can occur in patients taking which drug class? It's sulfonylureas, a drug used in the treatment of type 2 diabetes. They lower blood glucose by stimulating insulin secretion from the pancreas. In some patients, this can cause hypoglycemia or low blood sugar levels. Examples of sulfonylureas include gliclazide, glyburide, and glipizide. Yeah, it's so hard to pronounce. Which of these drugs is used to prolong the local anesthetic effect of lidocaine? Epinephrine. Lidocaine is a local anesthetic widely used, for example, in treating patients that undergo routine dental procedures. Epinephrine is used with lidocaine to prolong its local anesthetic effect. Which of these drugs can cause red-green color blindness? Ethambutol is a drug used in the treatment of tuberculosis. It is known to cause problems with vision, including red-green color blindness and optic neuritis. Other side effects of ethambutol include joint pain and liver toxicity, hepatotoxicity. Deafness and blindness can occur in patients taking which of these drugs? Quinine? Is that how you pronounce it? Quinine? Quinine. Quinine, I think. Is a drug used in the treatment and prevention of leg cramps, as well as the treatment of malaria caused by Plasmodium falciparum. However, it is known to cause serious adverse effects, including tinnitus, tinnitus, yeah, deafness and blindness. It can also cause QT prolongation, increasing the risk of cardiac arrhythmias. Patients taking which drug class increases the risk of developing infections? Corticosteroids suppress the immune system, thereby increasing the risk of infection. This is particularly true of corticosteroids taken by the oral route. Example of corticosteroids include prednisolone, dexamethasone, and beclomethasone. Which drug is associated with thrombocytopenia, a severe reduction in platelets? It's heparin. Heparin can cause HIT, heparin-induced thrombocytopenia. It's a condition where the platelet count is too low. Platelets are needed in the body to help close wounds. HIT can occur as soon as 1 to 4 days after starting heparin type 1 or 5 to 14 days after commencing heparin type 2. Heparin is anticoagulant drug blood thinner that prevents blood clots from growing or forming. Hence, its use in conditions such as deaf vein thrombosis, DVT, and pulmonary embolism, PE. Which drug causes an upper body rash, previously known as red man syndrome? It's vancomycin. Shortly after infusion into the body, vancomycin can cause an upper body rash, erythema, previously known as red man syndrome. It has been referred to as vancomycin flushing syndrome, VFS. Vancomycin is an antibacterial drug used in the treatment of serious gram-positive infections, including sepsis and endocarditis. Other side effects include ear toxicity, ototoxicity, and kidney toxicity, nephrotoxicity. What color changes can occur in urine when taking metronidazole? Brown. It's brown. Metronidazole is known to discolor urine a brownish tint. This is a harmless effect and typically resolves when the medicine is discontinued. Metronidazole is also known to cause a metallic taste. Metronidazole is antibacterial drug used to treat a variety of infections, including colitis, aspiration, pneumonia, and gynecological infections. It is also used to treat protozoal infections. Which of the following diuretics can cause elevated potassium levels? It is amiloride. Amiloride is potassium-sparing diuretic, meaning that diuresis occurs but without a loss of potassium. Therefore, potassium levels can rise, increasing the risk of hyperkalemia. Other potassium-sparing diuretics include spironolactone, eplerenone, wow, this is hard, eplerenone, and triamterene. Think of that mnemonic set: spironolactone, eplerenone, amiloride, triamterene. See these uh, names of medicine that I have never seen before. It's hard to pronounce for me, or I have never even read this before or see this word before. Extrapyramidal side effects occur in patients taking which of these drugs? It is antipsychotic drugs. Extrapyramidal side effects, EPS, refer to drug-induced movement disorders. Certain drugs classes, notably antipsychotic drugs and some antiemetic drugs such as metoclopramide, are known to cause the motor side effects over time. Extrapyramidal side effects include sudden involuntary muscle contractions, Parkinsonism, and feeling of inner restlessness. Okay, where are we? Oh, ito. PTCB federal legislation quiz. Okay. Which law was passed to ensure that medicines are developed in a child protected form? Mm, I think occupational health and safety. Enacted in 1990, which law requires pharmacists that fill orders for Medicaid patients to obtain record and maintain basic patient information? I think it is Omnibus Budget Reconciliation Act. Which organization is responsible for accrediting and certifying healthcare organizations in the United States? TJC or ISMP? I'm not sure. Which USP chapter sets standards and hazardous drug handling for patients, healthcare workers, in the environment? USP 797? Which of these medicines is classified as a Schedule 4 controlled substance? Maybe Drug Supply Chain Security Act, DSCSA, pharmacists are required to maintain product tracing documentation for how long? Mm, 1 year? I think. I don't know. Which legislation place prescription drug advertising under FDA supervision and require drug manufacturers to register and permit inspections of manufacturing sites? Okay. Which law was passed to ensure that medicines are developed in child protected form? It is Poison Prevention Packaging Act. Enacted in 1970, the Poison Prevention Packaging Act was passed to ensure that medicines were developed in child-resistant packages to guarantee that medicines are sufficiently challenging that children cannot open them. Enacted in 1990, which law requires pharmacists that fill orders for Medicaid patients to obtain record and maintain basic patient information. It is Omnibus Budget Reconciliation Act. OBRA, or Omnibus Budget Reconciliation Act, in 1990 established the protocol to require pharmacists that fill orders for Medicaid patients to obtain record and maintain basic patient information. This is vital protocol as it's something that directly impacts the role that pharmacy technicians play today, namely maintaining complete patient profiles. Which organization is responsible for accrediting and certifying healthcare organizations in the United States? It's TJC, or the Joint Commission, is responsible for accrediting and certifying healthcare organizations in the United States. The TJC inspects pharmacists during each accreditation survey, whilst also inspecting medication management standards to ensure that commitments to safety is held to the highest standards. Which USP chapter sets a standard in hazardous drug handling for patients, healthcare workers, and environment? USP 800 sets standards in hazardous drug handling for patients, healthcare workers, and the environment. The purpose is to establish standards that minimize exposure to hazardous drugs to workers in healthcare settings. Which of these medicine is classified as a Schedule 4 controlled substance? It is Ambien. The active ingredient of Ambien is zolpidem, a drug used for the short-term treatment of insomnia. It is a Schedule 4 drug. Other Schedule 4 drugs include benzodiazepines and tramadol. Under the Drug Supply Chain Security Act, DSCSA, pharmacists are required to maintain product tracing documentation for how long? 6 years. The DSCSA requires pharmacy to retain all product tracing documentation, transaction information (TI), transaction history (TH), and the transaction statement (TS) for a minimum of 6 years from the date of the transaction. This long retention period ensures that if a drug safety concerns or supply chain investigations occurs, the pharmacy can produce documentation proving where a product came from and who handled it. Case example: if a pharmacy purchases a shipment of atorvastatin on March 5, 2025, it must keep the associated TI, TH, TS records until March 5, 2031, even if the drug has long expired or has already been dispensed. Which legislation place prescription drug advertising under FDA supervision and required drug manufacturers to register and permit inspections of manufacturing sites. It's Kefauver-Harris Amendment. Enacted in 1963, the Kefauver-Harris Amendment placed prescription drug advertising under FDA supervision. The legislation also required drug manufacturers to register and permit inspections of their drug manufacturing sites. Which law established the protocol that drugs could be identified and reported using the NDC? Its Drug Listing Act. The Drug Listing Act 1972 established the protocol that drugs are identified and reported using the National Drug Code NDC. The NDC code is a unique 10 or 11-digit number assigned to each drug. There are three segments: labeler code, product code, and commercial package size code. For example, 0777-3105-02. The Orphan Drug Act was passed to promote research and development of drugs that affect which of these categories? It's rare diseases. Orphan drugs are those manufactured to treat rare diseases. Enacted in 1983, the Orphan Drug Act offers financial incentives to pharmaceuticals companies to research and manufacture these medicines. Dornase alpha is an example of an orphan drug, a drug used in the treatment of cystic fibrosis. Material Safety Data Sheets (MSDS) were mandated after which legislation was passed? Occupational Health and Safety Act. Material Safety Data Sheets (MSDS) were a product of the Occupational Health and Safety Act 1970. MSDS are forms completed by compound manufacturers to provide detailed commentary on chemical components. For example, details include hazards such as the degree of flammability and whether the substance has cancer-causing potential, carcinogenic. Diseases and conditions quiz. A patient presents to the pharmacy with a blood pressure of 142/91 mmHg. How are these figures most accurately described? I don't think I know this one. Okay, it's hypertension. Normal blood pressure is around 120/80 mmHg. Hypotension low blood pressure is lower than 90 to 60 mmHg. Hypertension high blood pressure is 140/90 mmHg or higher. Some system defines it as higher than 130. Stage 2 hypertension is anything greater than 160/100. Therefore, with a reading of 142/91, the patient can be described as having hypertension. Okay. Which of these conditions is caused by the organism Candida albicans? Thrush. Candida albicans is a yeast that causes thrush infections. Infection that can occur anywhere on the body. For example, vaginal thrush is common in women and may present as itchiness, stinging, or burning sensation accompanied by discharge. Antifungal drugs such as clotrimazole are effective at treating thrush infection. Melanoma is a type of skin cancer, chickenpox, is caused by the virus varicella zoster, whereas impetigo is a skin infection caused by bacteria, such as Staphylococcus aureus and Staphylococcus pyogenes. Drugs such as PDE5 inhibitors are used in the treatment of which condition? Erectile dysfunction. PDE inhibitors are drugs used in the treatment of erectile dysfunction, a condition characterized by an inability to develop or sustain an erection. Examples: sildenafil, vardenafil, and tadalafil. Which disease is characterized by the accumulation of uric acid inside joints? Gout. Uric acid buildup, hyperuricemia inside joints is the cause of gouts. Drugs used in the treatment of gout include allopurinol, colchicine, rasburicase, and probenecid. Bursitis refers to inflammation of fluid-filled sacs that protects joints. Rheumatoid arthritis is a condition in which the immune system attacks joints throughout the body. Osteoporosis is a bone disease where bone strength decreases over time, increasing the risk of bone damage and fracture. Which condition is caused by the immune system producing antibodies that cause the thyroid gland to produce too much thyroid hormone? Graves' disease is a form of hyperthyroidism where the body's own immune system attacks the thyroid gland with antibodies, causing the thyroid gland to produce too much thyroid hormone. Drug use in the treatment of Graves' disease include propyltyrosol and metamethasone. Metamazole, I see. A patient presenting with tachycardia and the pharmacist displaying which symptoms? High heart rate. Tachycardia refers to an elevated heart rate, typically defined as heart rate higher than 100 bpm beats per minute. Tachy is the prefix that means fast, whereas cardia is a suffix that denotes a relationship to the heart. Conversely, a slow heart rate is known as bradycardia, brady being the prefix that refers to slow. What name is given to chest pain caused by reduced blood flow to the heart? Angina. Angina is a chest pain caused by the reduced blood flow to the heart. Angina is often precipitated by exhaustion. Drugs used to dilate blood vessels and ease symptoms include nitroglycerin, beta blockers, and calcium channel blockers. Myocardial infarction is a heart attack where part of the heart muscles doesn't receive enough blood. A cardiac arrest is where the heart is arrested, stopping completely. A stroke, also known as cerebrovascular accident, occurs when blood supply to the brain has been disrupted through a blood clot or through bleeding. Which of these conditions is caused by an infection of a woman's reproductive organs? PID. Pelvic inflammatory disease. PID is caused by an infection of a woman's reproductive organs, a complication often caused by some STDs, such as chlamydia and gonorrhea. GERD, gastroesophageal reflux disease. MS, multiple sclerosis. BPH, benign prostatic hyperplasia, enlarged prostate in men. Inflammation of the liver is known by what name? Hepatitis. Refers to inflammation of the liver. Hepa is the prefix for liver related in etis is the suffixes that denotes inflammation. Gastritis is inflammation of the stomach lining. Dyspepsia is also known as indigestion, a feeling of fullness and discomfort after eating. Cystitis is inflammation of the bladder. What is insomnia? Having trouble falling asleep. Insomnia is condition where patients find it difficult to fall or stay asleep. Drug used in the short-term treatment of insomnia include zopiclone, zolpidem, and benzodiazepines. Short-term treatment is essential to prevent patients becoming physically dependent on the medicine. COPD is a condition that affects which organ of the body? Lung. COPD, chronic obstructive pulmonary disease, is characterized by restricted airflow and breathing difficulties. It increases the risk of infections, including chronic bronchitis and emphysema. Drug used in the treatment of COPD include beta 2 agonists and corticosteroids. What is edema? Fluid buildup. Edema, also known as swelling or fluid buildup, is caused by the accumulation of fluid in the body's tissue. For example, patients with heart failure may present with edema in the legs. Patients with significant liver damage may develop edema in the belly area. Diuretic medicines